Over the last year, many college students have reported that their mental health has declined. According to a study sampling students at Texas A&M, among 2,031 participants, showed that 48.2% showed a moderate to severe level of depression, 38.5% showed a moderate to severe level of anxiety, and 18.04% had suicidal thoughts. 71.3% said that their stress levels had increased during the pandemic, and less than half of the participants felt they were able to cope with the increased stress. That said, many college students may need extra help in this time. Here are 3 ways that students may be able to chat with someone and get some help with their specific needs. First, we have Cook Counseling, a VT facility that works to promote student learning and well-being. At this time, Cook Counseling has shifted to a telehealth format, but is still accessible to VT students. Specifics on eligibility are available on their site. In order to schedule with Cook, you will need to call them at 540-231-6557. On the Cook Counseling site, there are also resources for many issues a student may face, as well as links to webinars, virtual events, and more. According to the American Psychological Association, last fall, a third of psychologists said they were seeing more and more patients since the start of COVID-19. So finding a therapist today can be hard. Here, we will briefly talk about 2 options. PsychologyToday.com is another great resource for mental health. When you visit the homepage, there are articles and other resources regarding mental health and other topics. Through the site, you can also find a therapist that is right for you. You can enter your city and use different filters to find a therapist that specifies in your areas of need and/or takes your insurance. This can be very helpful if you are not sure where to start or how to find the right person for you. The third resource I want to talk about is BetterHelp.com. If you visit the site and fill out your information, you will be matched with a counselor. Once you are matched, you have access to chatting with them at any time as well as 1 telehealth session per week. BetterHelp does not accept insurance, but the costs vary based on your location and preferences. Keep in mind that if you have a mental health emergency, you should get immediate help and call emergency services or hotline specific to your needs. Mental health and getting help for any struggles you may be having is normal, and if you are feeling like it is something you may need, you should access any of these resources. I'm Ben English for DNR News.